It's my pleasure to be here today and an honor to represent my organization, Psychedelic Medicine Coalition, and the growing movement in the United States to integrate psychedelic-assisted therapies into healthcare. We are all here today because the momentum behind psychedelic science has accelerated globally. And in recent years, this work of translating that science into public policy is still rapidly unfolding. I started Psychedelic Medicine Coalition in 2021 after I was diagnosed with postpartum depression when my second child was born in 2017, and my own healthcare system failed me. We are based in Washington, D.C. We are the leading federal advocacy organization that is nonpartisan, and we're focused specifically on ensuring that safe, effective, and regulated psychedelic therapies become accessible to those who need them the most. We work directly with members of U.S. Congress, federal agencies, researchers, veteran organizations, and other nonprofits to shape policy that is grounded in science, ethics, and accessibility. Just this year, we helped support the introduction of the Innovative Therapies Centers of Excellence Act of 2025. It was introduced by the Psychedelic Caucus in the House of Representatives. It is a bipartisan bill that would establish $30 million at the U.S. Department of Veterans Affairs to create treatment centers within the health agency to deliver and study psychedelic-assisted therapies for veterans. It is the first legislation of its kind, and it's a sign that U.S. Congress is beginning to take this issue seriously, especially as it relates to the veteran community and treatment-resistant mental health conditions like PTSD and depression. As Rick mentioned earlier, we've also seen the Department of Defense fund $10 million for MDMA clinical trials that occurred in the National Defense Authorization Act last year. This is another major indication that there is forward movement in the U.S. and there's a growing bipartisan and institutional support in the U.S. But good public policy isn't just about passing legislation. It's about education at all levels. That's why PMC is also deeply engaged in public awareness and professional training efforts, helping to ensure that when the FDA does approve treatments like MDMA or psilocybin therapy, our healthcare system is ready to deliver them safely and effectively. In continuing to build the case for psychedelic medicines, we're also leading a national economic analysis project that's in partnership with healthcare economists at the University of California, Berkeley, University of Texas in Austin, and Johns Hopkins University. This project will demonstrate the cost-effectiveness of psychedelic therapies. The early data is extremely promising, suggesting that these treatments are not only clinically effective, but could save our healthcare system billions of dollars in the long term. While our work is focused on the United States, we know this is a global movement. That's why me and some of my American allies are here today. We are honored to welcome our European allies to our recent federal summit on psychedelic medicines in Washington, D.C. on May 8th. We saw firsthand how international collaboration can shape smarter, more humane approaches to mental health. And the Czech leadership in expanding ketamine access and psilocybin therapy is a model that many in the U.S. are watching very closely. We've also seen an evolution in the openness with federal government through the Trump administration. There is appetite for the potential of advancing psychedelics because of its potential in some of the outcomes that we're seeing in some of these trials. The Department of Veterans Affairs has expanded its interest in clinical trials and is involving MDMA-assisted therapy for PTSD, which is signaling an organic interest within the agency for more novel solutions in mental health. Furthermore, Robert F. Kennedy Jr. is now serving as Secretary of Health and Human Services, and we've seen a significant increase in dialogue about updating regulatory frameworks to facilitate research and access. Secretary Kennedy has expressed a willingness to consider evidence-based solutions that open the door for broader clinical applications. as well as signaling that there is a formation happening that is a public-private partnership group that's being led by Health and Human Services Administration. These shifts demonstrate that support for psychedelic medicine in the US is no longer a fringe position. It's gaining ground across the political spectrum, and at PMC, we're working to ensure that this momentum is translated into responsible policy that prioritizes safety, access, and scientific integrity. At PMC, we recognize that while psychedelic policy often begins with national borders, its success and its responsibility must be global. That's why international partnerships are a growing part of our strategic focus. As countries like Australia, Canada, and obviously the Czech Republic make strides towards therapeutic access, we have the opportunity to learn from each other's successes and challenges. One area where collaboration is especially powerful is in aligning regulatory and safety standards. As psychedelic therapies move closer to mainstream clinical use, we must ensure consistency in training, patient protection, and ethical delivery. PMC is in partnership with international organizations and policy leaders to explore a shared set of principles around safety, access, and research transparency. There's also immense value in data sharing across borders. When clinicians and researchers from different countries collaborate, we expand our understanding of how these therapies work in diverse populations and in healthcare systems. This not only strengthens the global evidence base, but helps accelerate adoption in more risk-averse countries or under-resourced regions. Ultimately, building an international coalition isn't just about policy efficiency, it's about solidarity, acknowledging that the global mental health crisis requires global solutions. PMC is committed to building a bridge and continuing to be a bridge between science and policy, not only in the US, but also between nations, to ensure that future of psychedelic medicine is safe, ethical, and accessible to all. As we move forward, we believe that cooperation across borders will be key. Whether it's aligning regulatory standards, sharing safety data, or building ethical and culturally sensitive models of care, we all benefit when we work together. Thank you again for the opportunity to be here today and for your leadership in this evolving field. I look forward to continued collaboration as we collectively work to advance the issue of psychedelic-assisted care, not just in our own respective countries, but around the world.